Hi, my name's Dr. Emma Butler. I'm a clinical psychologist and I've been working with children for over 20 years. And today I'd like to talk to you a little bit about why it's important or why it's beneficial to get your child a diagnosis of ADHD when they have ADHD. Many times I'll talk to parents about a diagnosis of ADHD and the parents are quite shocked and worried about this. And that's because ADHD is associated with a lot of negative stigma. So ADHD oftentimes is associated with bad child or maybe bad parenting or even bad therapist. People might think therapists that even bring up the idea of ADHD are misguided or old-fashioned or have the wrong idea about things. So even though all of this stigma is incorrect and based on misconceptions, it's very important to know how to manage this stigma and also to understand that it is really worth it to get your child a diagnosis of ADHD if they have ADHD, because there are many benefits. Benefit number one for why it's important for your child to have a diagnosis of ADHD, if they in fact have ADHD, is that the treatment for ADHD on offer, if your child has a formal diagnosis, actually works. And you know, it can work in some cases to up to 80%, which is really big for a mental health disorder. Now, I don't want to mislead you. I don't want you to think that the treatment for ADHD cures ADHD, like as if you have an ailment and you get a cure and it's gone for good. That's not the case. If you have ADHD, it's a developmental disorder that will last for the whole of your life. But the treatment will support your disorder, so your disorder is not going to impact on your development, on your self-esteem, on your mental health or your learning, and that's really big. Now, what I mean by its treatment and support then is kind of like in the same way as, say, I have a vision impairment, and say I'm at school and I'm learning and developing and my vision impairment is impacting my ability to see the blackboard. It's all blurry. I'm not learning to read. It's really hard to kind of take in information. And then I go to the optometrist and I get a pair of glasses. And all of a sudden I can see clearly, I can absorb information, I can learn to read, I'm on track, I'm absorbing information. So my vision impairment isn't cured, but it's supported with the glasses. And that's exactly how the treatments for ADHD work. They support your attention and your executive functioning so that 80% of the impacts of those issues will be eliminated by the supports, and the ADHD won't be impacting on your learning, on your development, on your self-esteem and your mental health. Okay, benefit number two for why it's important for your child to have a diagnosis of ADHD if they in fact have ADHD is that if your child has a formal diagnosis of ADHD, their environment or the people supporting them in their environment will understand what they need. ADHD is one of those disorders where how a child presents usually gets the kind of support they don't need, because it's really hard to understand what children need when they have ADHD, because sometimes children will present in exactly the opposite way for what's happening for them. Now, what I mean by that, because that didn't kind of make any sense, but what I mean by that is that take, for example, that child who's sitting down at mat time trying to listen to the teacher while they're talking. And the child, and you probably would have seen children like this, they're kind of fidgeting around, they might be kind of fiddling or playing with a bit of blue tack, and they're looking here, there and everywhere around the room, and they're squirming and fidgeting. And the teacher who's talking wants to support the child and quite genuinely looks at the child and thinks, oh my goodness, they're not listening to me, because the child doesn't look like they're listening to the teacher. So the teacher will maybe confiscate the blue tack and say to the child, look at me and listen. Now, unfortunately, the child was squirming and playing with the blue tack so that they could listen. those things were actually having the child be able to focus on what the teacher was saying. And now that the demand has been placed on the child to focus and look at the teacher and look like they're listening, all of the child's energy and attention is going to be placed on trying to look like they're listening, and their focus is on trying to keep still and not play with anything. And the child, all of a sudden, because all of their system and energy and effort is focused on those things, they won't be absorbing anything that the teacher says. So if that child had a diagnosis of ADHD, the teacher would know that the child needs to do those things in order to listen. And as long as it wasn't disruptive, they'd allow the child to do that. Okay, benefit number 3 for why it's important for your child to have a formal diagnosis of ADHD, if they in fact have ADHD, is that a formal diagnosis will actually reduce your child's chances of developing a low self-esteem because of ADHD. A lot of people think because of the stigma associated with ADHD that it's actually going to give their child a low self-esteem. But that's not really necessarily the case. You see, if the child doesn't have a diagnosis of ADHD, it doesn't mean they don't have the problem. They still have the problem. They're still in class thinking, why does everyone else know what's going on and know what to do and I don't? They're still in the playground thinking, oh, there's so much going on. I just can't work it out and I don't know what to do. And oh, a ball just hit me in the head. You know, they're still confused and they still know that other kids aren't. And left without an explanation, they're going to make up their own explanations for the problem. They're going to say, well, you know, maybe I'm stupid, or maybe I'm hopeless, or maybe I'm just an idiot. And those explanations are called core beliefs. And it's not like you sort of grow up and you can say, oh, well, I'm not an idiot. They stick with you for the rest of your life. And those are the kinds of explanations and the kinds of things we decide about ourselves that are actually creating the low self-esteem that people encounter and associated with depression and all sorts of other secondary mental health problems associated with ADHD. So when the child knows that they have concentration problems, they don't necessarily have to be told that they have ADHD. They can be just told that they've got concentration problems and these are the supports. They can understand why it's harder for them to absorb information than their friends. They won't necessarily say it's because they're stupid. They'll say, well, I have a bit more trouble absorbing information and concentrating, and these are my supports. And they'll also be empowered to know how to support and resource themselves for their problems now and for the rest of their life. And, you know, that's what empowerment is. So now I want to return to the original discussion around stigma. ADHD absolutely is associated with quite a bit of negative stigma. And if you're considering getting your child a diagnosis of ADHD, if they have ADHD, you really need some tips for how to handle this stigma. So the first thing that is really important is to know where the stigma comes from. You're not going to feel confident about having your child diagnosed with a disorder if you're still a little bit uncertain and worried about the stigma yourself. So the stigma actually comes from the fact that ADHD is one of the most oldest known mental health disorders that we have. It was actually discussed in the late 1800s, and like any mental health disorder back then, it was really not understood very well because our scientific understandings of the brain and mental health were really not even in their infancy. So, you know, it was first discussed as the defect of moral control in children. And that really reflects the kind of misconceptions that were around ADHD back 100 years ago. Unfortunately, though, because ADHD has been discussed for so many years, for over 100 years, those misconceptions have been really we've really inherited them. So even though we now know that ADHD is a neurodevelopmental disorder of executive dysfunction, those misconceptions that it's really about a child being a bad child or bad parenting or bad moral development have really come all the way through. So know where the stigma comes from. The most important thing too is that you know that you don't have to actually tell everyone that your child has a diagnosis of ADHD. You choose who to tell, and you don't tell all the people that are likely to judge your child who don't know anything about it, because they don't really need to know that your child has ADHD. And finally, it's really important for your child to know that they have difficulties and know what the supports are for those difficulties, knowing that they have concentration difficulties or however the ADHD impacts on your child. But you don't use the term ADHD with your child until your child is developmentally old enough to manage the stigma themselves too. Okay, so I hope that's really cleared up a few things about stigma for you and how to manage it. And I hope you understand now the three main benefits for having a formal diagnosis of ADHD, if you in fact have ADHD, being that the treatment really works. It really protects your child against developing low self-esteem and other secondary mental health problems. And having a formal diagnosis of ADHD will ensure that other people can understand and support your child and resource them in a way that is effective and meaningful for your child. Okay, thank you for listening.